but hello, everybody, and welcome to another episode of the Professors of Profit vlogcast. I'm your host, Dr. F Scott Feil, and I'm joined today by Dr. Gertrude Nonterah, who's got a pretty cool story about kind of going into a side gig and side hustle that she's now maintained for quite some time and really done a good job building up. So I'd love for her to introduce herself to the audience a little bit and tell us about what you're working on these days.
Thank you so much, Scott. I'm really excited to be on the Professors of Profit podcast. And about me, okay, let's talk about that. So I graduated from my PhD in microbiology and immunology in 2015. And then moved from Philadelphia, PA to San Diego, California, to start a postdoc. Because at that point, even though a part of me kind of knew I didn't want to be in academia, there was still a part of me that was like, well, but it's the best path. It's a path everybody trods, right? So why don't I just take that path, right? And so I came to start with my postdoc, but to be honest, I didn't feel very fulfilled in my job. It was work. I went to work, I came back from work, but I wasn't really fulfilled. But prior to this, I had sort of kind of stumbled into the world of blogging and writing online and making money online, right? And so I was like, that's interesting. And I found that, when I would come back, and not to say that I had I didn't have difficult advisors. I had a really good working environment. I just wasn't feeling fulfilled. And I think maybe that's like number one lesson, is that you can be in a place where everything is aligned, everything seems good, but there's something still off internally and you know it, right? And so for me, that was how it was. And so when I discovered writing online, blogging online, I decided to try it. And it became really relevant for me when we moved to California to start my postdoc, because California is super expensive. And unfortunately, the salaries haven't caught up with that. And most postdocs, for those of us in the sciences, are paid on the National Institutes of Health scale. And so whatever it doesn't matter where you live, it's the same scale. And so somebody living in rural, maybe a rural area of the US, and somebody living in a really expensive place like California will be getting the same salary, right? It needs to be adjusted, but it is not. So I decided to start writing and doing social media. So my first side business was handling social media for local businesses. So I had a handful of local businesses, and I'd essentially post to their Facebook pages or Twitter. That back then, I feel Facebook and Twitter were the biggest things. Instagram was still pretty young. LinkedIn, I don't even think anybody was really using that for social media. YouTube was around, but I didn't really know how to work that, but I didn't know how to do Facebook and Twitter. So I started making posts for them, and I get paid. I think at the time I was charging people $300 a month to handle their social media. And so I did this for a while, had a handful of businesses for about a year. And then I kind of switched into freelance writing, which kind of ended up being my current career, which is medical writing. So eventually, just doing that side hustle helped me build the skills for writing, helped me learn a lot about the industry, and helped me basically turn it into a full-time career. So maybe we can talk about that, but that's a little bit of my side hustle journey. Right now, my side business is a business called the Bold PhD, and essentially on there, I just help a lot of PhDs who, like me, kind of know something is off, but are not really sure how to even look for non-academic careers. I create content for them.
Yeah, I love that story. There's so much to unpack there. And, things are expensive these days, right? One of our biggest issues in the physical therapy world is the debt to income ratio for student loans. So let's say you have your 9-to-5 job and it pays, anywhere in the $70,000 to $100,000 range, right? Which is kind of normal for physical therapists. But then you also have a $1,500 a month student loan. Luckily they're on freeze right now, but eventually they're going to be due, right? They're going to come due. you may be able to pay your overhead and everything you need for bills with your job, but then that $1,500 may be something you can't afford, right? So now you've got to find a way to supplement it. And a side gig or a side hustle is a good way to kind of start that and kind of do that.
Absolutely.
But the other thing too that you talked about that I thought was super important is you may be in a perfectly fine situation and setting and still want to explore a side hustle for fulfillment purposes, right? I do that. I teach 9 to 5 because I need the medical benefits for my wife, right? But I love teaching. I enjoy it. It's a great job. There's nothing wrong with it. I'm just a little bit more passionate about business and about side hustles and side gigs and ways to incorporate and layer different streams of revenue that have now helped me to kind of match my salary, if not exceed it, with the side hustles and side gigs by, kind of adding multiple. So by doing that, I feel fulfilled. I'm passionate about it. It's my passion projects, my babies. I love them. And I love teaching them. So it's a nice combination. I finally found a pretty good fit of things I love to do. So I think that's super important for people to realize that it doesn't have to be a boring, dead end, terrible job situation that pushes you to get out there. That could be part of it. And if that's the case, I strongly recommend you do, find something else. But it could just be kind of that unfulfilled feeling of like, I feel like there's more. And that's one of the things that I try to preach to physical therapists is like, we have to get out of that clock in, clock out 9 to 5 mindset. It's a great job. It's a great profession. We help people, we get people better, but there's still going to be a ceiling at some point. No matter what setting you're in, there's a ceiling to how much you can earn. Whereas once you do your own thing, that ceiling kind of tends to go away. You can kind of make it, sky's the limit at that point.
Yeah, really, the sky really is the limit. I totally agree. You can make as little or as more, it really just depends on how much time you have and how much time you're willing to put into it. But I absolutely agree with that entrepreneurship is like one of the only careers where there is really no cap on income. Now, it is hard. It's not easy. It's not simple. But like you said, there's a part of you, for me, there's a part of me that's completely fulfilled doing that. And I feel like by being fulfilled by something, it helps me be better at my job, right? By having a side hustle that, it helps me better because now I'm like, oh, well, I can do this right now. I mean, right now I do enjoy my career. But back when like enjoying my career wasn't a thing, it was like, okay, it's okay. I'm going to do this right now. And then I get to go home and I get to do something fun. Right. Yeah, absolutely. So absolutely agree with you there.
Yeah. I mean, entrepreneurs will work 80 hours a week so they don't have to work 40 hours a week for someone else. Right. It's that cliche phrase and saying, but yeah, I think realistically, like if you look at the big picture, right, one of the things that, and again, we can call it academicians, but really my first doctoral degree was a clinical doctorate, right? The doctorate in physical therapy, right? The DPT. And weirdly enough, in order to teach at a PT program, you do need that at least a DPT, but really most academic programs for the DPT require a terminal degree, like a PhD, like an EdD, like I got, or a DSc, or, a terminal degree, a PsyD, something that's going to propel you to that top level, which doesn't make a whole lot of sense. Cause it's like, why is the DPT not good enough to teach at the program that you just went through? Like it, right. But CAPTE, our governing body, recommends at least 50% of the faculty hold terminal degrees. So, if that's what you want to do and teach full time, you may have to pursue a terminal degree. It's a really messed up situation. But the one thing I love about it is we can take our expertise in physical therapy, in teaching, in educating, and all of that, and turn it into some sort of side hustle or side business that we do love to do, right? If your 9 to 5 limits you and keeps you, you have to do it this way for this amount of time on, in this subset or whatever, you do the best you can with that, and you try to excel at it. But then when you get home, again, those limitations tend to go away, and now you can really have fun and experiment. So like for you, I love the fact, and I've done a lot of this too, because I was an English major before I became a physical therapist. So writing was always key for me. I knew I was going to write a book at some point. Luckily, I finally was able to publish one. But medical writing is another thing that I've kind of done on the side for like blogs, for websites that needed to, build a digital footprint and get their search engine optimization or their SEO up, right? I've done I ghost wrote a book for a urologist, right? Do I have that knowledge? No, but I have enough medical background to know what it should look like and how it should read, and then I give it to the experts to fill in the blanks and be the one that kind of ties it all together. So like using those skills that you were already good at and that you're doing in your 9 to 5 to then turn it into an expertise outside of the 9 to 5 is a super smart way to start a side hustle. So can you tell us a little bit about some of the medical writing and stuff that you do now that, outside the 9 to 5 for your side gig?
Right. So with my full-time job is as a content specialist with a health and science marketing agency. And I mentioned that because, again, going back to the story about not wanting to be in academia, you may go through your DPT training, you may go through your nursing training, you may go through whatever the training is, get to the end and realize that maybe I don't want to be in the clinic, maybe I want to do clinic part-time, and maybe I'm looking for another career path that is interesting to me, which most of the time is done remotely, which it's not as physically demanding, right? And I would recommend medical writing. And what do medical writers do? As a medical writer in a marketing agency, there are different types of medical writing, so that's important to take note of. But in my role, essentially, I'm creating content for your biotechs, pharmaceutical companies, health and life science companies that are focused on, of course, their businesses. So they're focused on selling something. And so we create marketing material for them. And those could be blog posts, those could be social media content, white papers, technical application notes, it could be anything, right? And we write this for them and they're able to use that in their marketing efforts. Right. So that's the kind of medical writing that I do. Very, very business focused. You can also have medical writing that's education focused, right? And so you perhaps, like you said, you helped to write a textbook. You may be, and also SEO, going back to marketing, SEO is important in what I do. Search engine optimization is important in what I do because I write blog posts as well. But essentially, when you go into medical writing, that's for education, you may be writing textbooks, you may be writing continuing education units for professionals, for healthcare professionals, right? And so on. You may go into regulatory. And so when you're in regulatory, you are really working in I think for a lot of DPTs, maybe if you wanted to go into regulatory medical writing, a lot of medical device companies, you may think about a company that does physical therapy devices and then join them as a medical writer, because over there, they need the FDA to approve the devices, right? To say this device is a medical device and it can be used by people. And regulatory individuals are really, really important in these roles. So there are different ways that medical writing can go. But the way that I sort of seed into what I'm doing now is I also have a background in nursing. And so when I was in between, at a point, I did lose my postdoc because funding ran out. So in between when I was, I lost that job. So when I finally got another job as an adjunct professor at a community college, I was freelance writing, and I was freelance writing content primarily for people in the healthcare space. I taught myself a lot of self-education went into that. I read a lot of blog posts, I watched a lot of videos, I bought courses, I bought books. So investing in your own learning is going to be really and absolutely important if you want to build something that actually makes money, right? And helps you pay your bills. And for about 1.5 years, I was paying my bills off of my writing, right? Of course, I'm married, so that was how I was contributing to our household. So I really do think that it's just doing that during that time when I wasn't working, and I also had the writing as a side hustle, but really built it out when I was unemployed and just freelance role. And to be able to be unemployed and live off a freelance income, that means it was respectable income, right? And so and for almost 1.5 years, by the way, it was good income. Eventually, the way entrepreneurship is it can be feast or famine, right? You can really do well, and then some months it's like, I remember the way that I knew that, okay, Gertrude, it's time to go back to something was when I think in 1 month, like my biggest clients decided that they no longer needed my services and they moved on. And that was like almost half of the income. So I was like, okay, time to maybe think about going back into full-time employment. But yes, that's essentially how it worked out for me as a writer. I started first of all as a side hustle, as a freelance writer. Then once I had built those skills and I really knew what I was up to, applying for medical writer roles in a company where was not a difficulty, and here we are today.
Yeah, I mean, for me, right? So if we go back, I was an English major, right? So when it came to my dissertation time, I thought, oh, this will be simple. I'm a great writer. This will be a breeze, right? Well, no, scientific writing is a completely different beast, and I was terrible at it, and I had to relearn how to write. All right, so I did that. They dragged me across the finish line, kicking and screaming. Right, I get the EDD, and I'm done. Right, and I think, all right, I need a break from academia. I'm not going to do that for a while. I'm burnt out. I need to go back to the clinic and work. And then COVID hit around 2020, and I went then to academia, which was a good fit at the time, right? But while I was doing that same thing, I started some side hustles and a mobile physical therapy practice, a copywriting practice, and mainly it was because I needed that stuff for my business, right? So I had the skills to be a physical therapist and maybe do some medical writing, but I thought, again, I was an English major, copywriting will be a breeze, right? Wrong again. Right. I literally had to, there were 6 to 8 books that I read over the course of 3 months that once again retaught me how to write for copywriting purposes. It's a completely different language, completely different beast, right? Because you're trying to help, not directly sell, but help people make well-informed decisions based on the information you present so that they can make that choice of whether they're going to purchase or not, right? So that was tough for me, but it was good because it showed me that even though I may have a ton of skill sets and I should utilize those for my side hustles and side gigs, there may be some skill sets where you have holes or gaps and you need to go out and find them and read up on those and take courses on those and do the work you need to do and invest in yourself to then eventually get good enough to do it for your business or your practice. Once you can do that, then you can offer those skills to other businesses too. So it kind of translates down the line. And that's where I finally got decent enough at copywriting, was, working on my own stuff for a while, reading all those books. I actually compiled a list of the best copywriting books. And I just give that out to people as a PDF. It's like, hey, this helped me. If you want to do copywriting, I would recommend reading some of these books because it is not as cut and dry as you think.
Yes.
And so, tell us a little bit about like some of the tips, tricks, and pointers you would give to people who are maybe just starting a side hustle or side gig, but then also looking to go into like medical writing.
Mm-hmm. So I would say, if you want to start a side business, first of all, just start with one idea, right? Start with one idea and see how profitable it gets. Like, because I remember when I got started, like every idea that came to me, I was like trying to do it. I tried to sell on eBay. I tried to start a YouTube channel. I tried to write an ebook. No, if you try things, it's not going to work. You're going to get frustrated. So the best thing to do, eventually, where I saw success was pick one thing, Gertrude. Just pick one thing. And for me, at the time, like I said, it was social media. I was using social media to drive traffic to my blog at the time. I knew how to do that. So I decided, okay, I'm going to offer this as a service. I offered it as a service. People were paying me. I had about 3 or 4 clients paying me $300 a month. That's an extra $1,000-something in my pocket, right? So now I had proven that this business is viable. I can get people to hire me as a social media manager. I can get them to pay me and I can make this much. So if I wanted to go by this much, then I need this many more clients, right? So I think it's really important to sit down. You can look at a list of things, right? Based on your skills, based on your experience, right? What experience do you have? What skills do you have? You may be thinking, oh, I've just been in school. I'm just been in physical therapy school, whatever school you're in. I don't know anything. Okay, that's not true. First of all, because you know a lot. Could you tutor people in a particular course? Right? Could you tutor people in a particular course? There are several websites out there where you can list yourself as a tutor, right? Could you join the what do they call it now? to it's sort of like the, Uber, Lyft, all these things that are out there now. I forget what it's called. It's something economy. They're sharing economy or something.
Yeah.
Right. Delivering food, right? Maybe that's something that you like to do, something that you know how to do because you did it before. I know people who end up making around $500 a week doing that, right? Could you maybe write a book and then begin to sell that? So if you think about all these options, think about the one that has the least path of resistance and start with that. And for me, that was social media because I was already using it. It was like, it was super easy for me. So that was easy. So creating content for other people on social media just felt like a game to me. It just felt like a game I was getting paid for. So think about something that has the least path of resistance, stick with that, let it become profitable. My advice, get it to like $1,000 a month and see how that feels. Right. And then once you get to $1,000 a month, you're like, okay, now I can get $1,000 a month. And I always have believed this. If you can make $1,000, you can make 5,000, you can make 10,000. Right. Yes, there are different mindsets and everything that get to that point, that help you get to that point. But the idea is that if you can make even just $1 inside business, you can make as much money as you want eventually. So I think that this is really important to take into consideration. Number two is, even though you may have chosen a path to go on, never stop investing in yourself, right? Scott, you talked about those copywriting books that you spent 3 months reading. Excellent, right? It may be books for you. It may be podcasts. It may be podcasts. Yes, I think those are a good one, but usually sometimes podcasts fragment the information because it's coming from different sources and different people. Definitely at the beginning of my side hustle, podcasts were so helpful to me and they actually helped me get to where I needed to get. But I would say to invest in books, to invest in courses that speak to that specific thing that you're looking for. Don't go try learning about Amazon FBA if you're not trying to do that right now. It's going to be a waste of your time. It's going to take up your resources. If you're learning right now about how to do social media, then go find courses, go find YouTube videos on how to, maybe you want to manage people's TikToks or whatever. Go find how TikTok works and learn everything about TikTok so that you can do that, and then once you do that, you'll find that because you have that depth of knowledge, you bring that to the table, people respect that and people pay you for that, right? And so that's the other thing. And number three is really not to listen to the naysayers because you're gonna have many. You're gonna have so many, and it's important not to pay them any mind. And don't think your friends and family are going to patronize your business because most of the time they're not.
Right. They're not your ideal customer, your avatar most of the time, I promise. There's a lot of great points there. So, one of the big things is the shiny object syndrome that you kind of talk about, right? Like I use the feel good method. It's not just a clever play on my last name, but it's an organizational thing that I use to start 8 to 10 side hustles within 3 businesses, but it was one at a time. Right. And until one was up and running, you can't go on to the next one. And that took the better part of 2 years or so to get them all functioning. But then once I was able to figure them out, learn them, get them all functioning and profitable, I could then organize them into the 3 businesses that offered all those services then, and they were divided up where they needed to be. So I organized them under this method that I use. And realistically, just having all those abilities now and having learned, lead generation. I had no idea how to get leads, for my mobile business, right? I had to learn that. So I took a course completely out of my wheelhouse, something I had no idea how to do. It was an expensive course. But again, it was that mindset of, no, I'm investing in myself and my business. And sure enough, that course got me my my second and third client, which then more than paid for the course. And then the rest was profit. So everything I learned from that course, now I applied to it, was able to get some more patients, and, it all paid for itself. Absolutely. So it's the difference between, that's so expensive, I don't know if I can spend that money, versus I'm investing that money to make, myself better and to make my business better.
That's
So
right.
I think that's definitely a mindset you have to work with.
Definitely a mindset. And Scott, something that I always argue with people on. I always say, I know in the health sciences, we're very fortunate in the sense that there is always demand for health professionals in the United States, actually worldwide. And so when you are a health professional, it's less likely that you'll be out of a job. Less likely. I'm not saying it's impossible, but it's less likely. So most of us, our degrees end up paying off, right? But the point I'm trying to make here is that so many of us pay so much money for these degrees, right? A lot of money for these degrees, and you can still get laid off, right? So, so the point I'm trying to make here is that if we are more than willing to spend hundreds of thousands, tens of thousands of dollars for a degree that doesn't necessarily guarantee a job, why wouldn't you spend a little bit of money, maybe $200? Sometimes it's maybe more, a little more than that, to invest in something that you're going to be using right now. I know that that can be controversial, but I've always seen it from that angle, and it helps me to overcome the hurdle of, oh, I should invest in this right now. It's an investment. It's going to pay off. I've seen so many things. The first time I had to invest, and this is not saying you should invest this much money, but the first time I invested about $2,000 in a coach, I was so nervous. I was so terrified. I was like, my goodness, that's a lot of money for me, right? But then I went through that coaching experience, and I needed it. 2 years after the fact, it's paying off in bucket loads, right? Whereas I could have held on to that $2,000 and said, no, this is my precious hard-earned money. I can't do that. And then I wouldn't have what I have today. Or maybe it would have taken me 10 years to get to this point. But because I had that coaching, it took me less than 2 years to get to that point.
Yeah, I mean, if the pandemic has showed us anything, right, it's that no job is furlough proof or bulletproof, right? I mean, physical therapy is an amazing safety net. There's always going to be a need for physical therapists in any city you live in across the country. And like you said, probably even worldwide, right? There's just going to be that need. It's a pretty safe job. It's always ranked in the top 10 or so of US Business Weekly or whatever it is. It's shifted a little bit lately, again, because of that debt to income ratio. But for the most part, you're going to be able to find a job in physical therapy, even if it's just short term in a setting you don't like or whatever. You'll be able to get a job. So why not take the risk and go for it, try something that even if it fails, you fall back to that safety net, right? Not a huge deal. But I personally, I'm much like you. I'd rather die on my own sword, right? And go for it and try it and have my own control my own destiny. If it's not working, figure it out until I get it working. And then, like you said, we end up, blowing that ceiling up and the sky becomes the limit, right? But I think too, people they have that mindset block and that argument of like, oh, why would you pay for a mentor or a coach? Like, that's so much money. And that, what are they going to teach you? Well, it's like, okay, look at Major League Baseball players, right? They have coaches that help them hit. They have coaches that help them pitch, right? But the best players in the world still have coaches, right? But does the coach go up there at bat and hit? No, the player does. So you get coached, you take the feedback, then you go out and you perform. Right? You've got to implement, same thing with football players, right? They've got quarterback coaches, they've got line coaches, they've got, defensive back coaches. Those coaches get them ready to be the best person they can and then send them out onto the field to implement, right? For me, mentorship and coaching has sped up my timeline. That's basically why I paid for a coach. Was like, look, I know what I need to do. I don't exactly know how to do it. This person's done it already. I respect them. I follow them. I love what they do. They're already kind of doing what I want to do, just in a different kind of field. Maybe I can learn from them. And sure enough, pay for the coaching, go through the sessions, learn the stuff. And now, boom, I'm 3 months in and I'm rocking already. Whereas if I didn't have it and I had to find it out myself, which I easily could by doing the research, that's a lot of YouTube videos. That's a lot of Google searches. That's a lot of books you got to read. Yeah. And if you've got somebody that's already got the path paved for you, to me, that money was well spent.
It was. It is. So I'm going to agree with you that it absolutely is. You have to, of course, take all your finances into consideration, but ultimately, I find that investing in yourself is going to pay off in wild like wild droves. So, and when you think of it in that sense, it ends up paying off.
Yeah. And I mean, like, all right, let's look at the big picture here, right? You can get all the certifications in the world and have alphabet soup after your name as a physical therapist, and the general public has no idea what that means. So do we have to get CEUs to stay certified and licensed every 2 years or so? Yeah, we do. But you can get them at attending a conference, right? And that to me is a big network event anyway. So you might as well do that. If you want to get some specialization or certification, that's fine. It makes you a better clinician. Totally on board with that. If you feel like you need that, great. But it's not going to do a whole heck of a lot. You're not going to get paid anymore. There's no difference in somebody who doesn't have that certification and somebody who does, as far as reimbursement goes from an insurance standpoint. So what are we doing here? Why spend the money on a CEU when you can spend the money on a business coach and start your own thing and really drum up a business and make more money, But again, the money's not even the main thing, right? Let's just take the physical therapist again, right? If you're the best physical therapist in the world, but nobody knows who you are, how to get to you because you don't know how to market yourself or your business, nobody's going to come see you. So again, it doesn't matter. Mm-hmm. So again, I'm a fan of, the business and marketing aspect of things, trying to build your brand, which I know you're very big in. And once you've done that, then you can start really crafting your skill more, and you can do it while you move along. But again, like you said, it's knowing your finances and knowing what you can do with them.
Yeah. Yeah, absolutely.
Well, Gertrude, I just want to thank you so much for your time and for coming on to talk to the audience about medical writing and the process of side hustles and side gigs. Where can people reach out to you? Where can they find you on social media and on the interwebs if they want to learn more about you and what you're up to these days?
Yes. So I'm very active on LinkedIn. So LinkedIn is a good place for you to come find me, Gertrude Nonterah, PhD, RN. So come find me there. I do have a YouTube channel. I have my YouTube channel is the Bold PhD. There are videos on medical writing there. So if that's something you're interested in, you could check that out. I also have coaching services. So I have a 1 hour, usually career consult. So if you want to coach with me, talk with me about your career, thinking about your career, maybe thinking about a career outside of your field. I'm very good at that, and so you should chat with me. Thank you so much, Scott. This has been awesome.
Absolutely. We'll put all those links in the show notes so people can get to you very easily. Gertrude, thank you again so much. It's been a pleasure.
Absolutely. Thank you, Scott.